Welcome to another episode of Stories from the Edge of Life. We once again have a very special guest, Erica Vega. Uh, Erica, welcome. Would you mind
Hi,
introducing yourself to our audience?
sure. My name is Erica Vega. I am a stay-at-home mother of three who now has kind of an at-home business that I run after years of experience in oncology and palliative care as a bedside nurse and nurse practitioner.
Great. And I'm Parag Bharadwaj. I'm a hospice and palliative medicine physician in the US. And I've had the pleasure and honor of working with Erica in the past.
Yeah, I was a very young nurse when we started working together. I got into stem cell transplant oncology patients as a bedside nurse at the young age of I think I was like 24 when I started, which is shortly after that we crossed paths and would work together with our patients.
Great. Yeah. And we talk about those experiences that we had together with our in caring for our patients. All right. So, Erica, let's start off with what got you interested in pursuing nursing as a career.
So nursing was not necessarily something I always grew up knowing I wanted to do. I actually thought I was going to be a brain surgeon when I was younger. Um, I thought I was going to be a brain surgeon and go to UCLA, and that quickly became something I was maybe not so interested in as far as how many years of schooling that was going to take. I was attending school. I was playing softball, and I needed one more credit for to stay on the team. So I took a career planning class, and the standard testing basically determined that I should either go into nursing or being an educator, being a teacher. There were a few other options, but those were the two that kind of stood out. My aunt is a nurse, and so she was like, go be a nurse, you can make a lot of money. So because of that, I actually was going to go and be a teacher because I didn't want to feel like I was doing anything for money. I did a few interviews with her and with one of her best friends who was a NICU nurse. And I was so intrigued with what I learned through my interviews because of this career planning class that right after I started taking all my nursing prereqs. I was gung ho, 100% sure that I wanted to be a nurse, but for all the right reasons and not for anything that felt icky for me. I didn't want to feel like I was doing it for the wrong reasons. So that's how
Wow.
nursing kind of fell into my lap. And every rotation in nursing school, I was like, oh, this is what I want to do. So, like, the first rotation was at a skilled nursing facility. I was so convinced I wanted to work at a skilled nursing facility and work with, the patients that were there. And it was a lot of elderly patients. And early on in my nursing journey, I was exposed to, end of life and cancer diagnoses. And I was just enthralled with when I did my ER rotation, when I did my peds rotation, like I just loved every component of my nursing education. And it was when I did my last rotation that my teacher and mentor and friend, um, suggested that I go into oncology. And I wasn't sure why she thought that that would be good, but I went ahead and interviewed at a location that she recommended. And before graduating, I was lined up with a great job on an oncology unit and ready to go.
Great. So, as you were going through your experience with patients, um, what was it that confirmed that you picked the right field for yourself?
Um, Ever, like I said, even in nursing school, I would leave feeling just so good about what I was envisioning myself doing in the future, taking care of people, making a difference in somebody's life, interacting with the patient's families. Like, it felt good to me. I'm sure as med school as well, like you're up late studying, you're up early trying to get to your clinicals and do what you need to do. It doesn't feel like such a burden when you're doing something that brings joy to your life. So it was something that brought joy to my life early on. And every, I mean, I don't want to say every day because there's days every now and then where you're like, do I need to go to work? But overall, like I loved taking care of people. And there are some challenging people to take care of sometimes, but I was able to always, connect and realize like there's these people, despite their, maybe poor attitudes, they need somebody to take care of them. And today for 12 hours, that's going to be me. And I'm okay with that. So it's just always been something that truly brought me joy to know that I was helping others.
That's amazing that you found something that you're so passionate about. And it seems like you did all the research before you jumped in.
I did, and it wasn't necessarily, like I said, expected. When as I was graduating from nursing school with my associate's degree, I remember thinking like, I can't believe I did it. Like that was probably the hardest thing I had accomplished in my life up until then. Um, it was definitely challenging. I mean, to say I didn't know the difference between aspirin and Tylenol and Advil, I, I I went into this really not understanding science, really trying to, I had to put extra effort into studying. Um, there was even a class that I missed passing that class by 1.5%, and I had to repeat it. And after that, I was like doubling down on the study time. And I knew that that wasn't going to be anything that stopped me from pursuing this career because I was so convinced already that this was something that I wanted to do.
Great. All right. So from there, you went into this complex world of being an oncology nurse. Tell us about that experience.
Well, first of all, I feel like I really worked with amazing nursing staff who were really willing to take me under their wing and educate me along the way. The education that I got on site for really learning the chemotherapies and learning which drugs were really going to be best for helping relieve the symptoms that go along with those cancer drugs and the diagnoses and just all the side effects that they could get, and then also just really getting to pick the brains of some of these oncologists and other providers, to truly learn what I could do to add value to these patients' lives. And then, of course, you walk into patients' rooms and being a young nurse, I really loved what I was doing. And a lot of times I felt like I was that like bright sunshine that they needed for the day. Sometimes I was asked to dim it down a little because it was just too much, like stop smiling so much. So I could adjust based on the room I was walking into. But I just truly loved what I was doing. And um, I'm so thankful for my friend and teacher and mentor who kind of handpicked me for oncology, because I truly feel like it was just such a great fit for me that I would have not necessarily identified myself, as a new grad nurse, not really knowing what I was going to do. That population affected me in a positive way, for the rest of my life.
Got it. So most folks would think, at such a young age, picking a field where, you're taking care of cancer patients could be depressing. I'll be
Yeah.
very direct with that terminology. Uh, what did you experience, and what do you think, made you continue being an oncology nurse? Because it's not easy being one.
I have nothing to compare it to besides like my jobs before that, which were like restaurant jobs and, maybe my experiences in clinical rotations, there's no way that I could envision myself working with any other population. To me, it wasn't depressing to go and go do this type of work. Yes, there were days where there was heartbreak and it was sad and it was like, why does this person, have to suffer like this? But for the most part, it brought me joy to know, I would connect with patients and we would have long-term relationships as they, got readmitted and typically a lot of cancer patients will get their chemotherapy in the outpatient infusion center. And so a lot of those patients, I wouldn't see them. The types of patients that I was seeing were the leukemics who were going to be coming in, staying, on their first admission. Typically they're there for 4 to 6 weeks. You really get to know somebody in that time frame. You get to care about them. You get to know their family. It was sad to know, okay, they're dealing with this life-altering diagnoses, but it was also just really amazing to know that you were going to be their person. You were going to be the one to help with their pain. You were going to be the one to call the doctor and really make sure that they're on the right regimen for their nausea, for their diarrhea, for their constipation, for their pain, for whatever. And to go in there and just get to chat with them here and there every once in a while, administer their blood products, educate them. You know that you're adding value to their life, whether they have 20 years ahead of them or 1 year ahead of them. It didn't matter. And I say that loosely because it did matter, but at the same time, it wasn't. It was a beautiful bond that to know that somebody trusts you makes you feel good about yourself, and for them to know that they have somebody in their room for the day who they could truly count on, who they know, if they use their call light, if I'm not busy doing something, I'm coming in and I'm going to help you. A lot of people, I do kind of get that reaction a lot, oh, you worked with cancer patients. But for me, it's yes, and it was absolutely a perfect fit for me in the phase that I was in, as far as, my age and my experience as a nurse.
Great. So then you went from being an oncology nurse to picking a career in palliative care, and you've become a palliative care NP.
Yes.
So tell us about how you ended up making that decision, because when I worked with you, very pleasant to work with. You provided very high quality care to your patients. I will be frank with you. I never thought you'll end up being a palliative care nurse practitioner. I mean, I'm pleasantly surprised. And a part of me is not, because you just had that heart, and you were able to connect with patients so easily. So tell us about, when did you start thinking about picking that as a career? Because if people were coming to you, I'm sorry to interject, but people were coming to you that, hey, oncology is depressing, a lot of folks feel that palliative care is even worse than that.
Right. So similarly, it wasn't necessarily the plan for I'm going to go and become a nurse practitioner and I'm going to jump into palliative care. It was more, I wanted a change. I wanted a challenge. I wanted to do something different. So it was either I was going to get into UCLA, because like I said earlier, I thought I was going to be a neurosurgeon from UCLA. So it was the only school I applied to for my NP, because it was my only school that I would really want to go to for my master's degree. And it was either I was going to get in there and work on my nurse practitioner degree, or I was going to ask for a transfer over to ICU, because I really wanted kind of a next level challenge. I loved what I was doing, but I wanted something a little different, and I wanted it to be challenging, and I wanted to continue helping people who truly needed somebody. So I got into UCLA and started that program. And so when I was done, I actually went to work private practice for an oncology doctor. And my experience was not the best in the sense of I found myself really wanting to address symptom management in a better way. And it just wasn't necessarily in line with what that private doctor, was agreeable with. There were a few things, and so I reached out back to the hospital that I had worked at for so long as a bedside nurse, and there was a position available as a palliative care nurse. And I thought, oh my gosh, yes, that would be awesome. So, that ended up working itself out. And lo and behold, I actually ended up working with cancer patients. I worked in the cancer center, working alongside another provider or two, and really diving in and learning so much about the palliative care world as a provider. As a bedside nurse, I had my experience, but as a provider, it was a little different and I was loving it. I loved that I got to still work with my oncology patient population. I knew some of the oncologists, I knew some of the nurses down in that area in the cancer center because a lot of them were nurses that had worked on the floor before. And it was definitely kind of a perfect transition for me, because I was now learning how to have these, goals of care conversations and conversations about end of life in an appropriate way, and really also address symptoms as a provider from a completely different angle and learn about new drugs that I maybe hadn't really realized while I was working as bedside.
Were you surprised about anything that you experienced during your training in palliative care? Because you'd seen quite a bit when you were an oncology nurse. Anything that stood out in terms of the difference in practice?
I was really not aware of how palliative care teams worked. When what comes to mind right away is the social worker's role. I was so used to the social worker role on the floor, as bedside, but I quickly was educated on how a palliative care team works together with potentially a palliative care social worker, a palliative care pharmacist, right? All of the different team members that would come together and truly be this blanket of support for the patients whose doctors were accepting of the palliative care team to be working alongside the oncologists to be that support for the patient and the family. I think that was probably one of the surprising, components is like really realizing like, oh, I was so used to just seeing maybe a provider come. But here I was getting exposed to the full team approach to being that support for the patient and for their family, and truly being kind of the glue for the team in certain situations, meaning bringing, maybe 2 or 3 different providers and having these group meetings, family meetings with the patient, and truly being the patient advocate, in a way that was truly just very beautiful to me to witness. Of course, there were medications that, I wasn't aware of that could contribute to improving symptoms in one way or another. I was aware of a couple, as a bedside nurse, but maybe I had been giving certain medications and not realizing why truly they were being given before.
And just for the sake of the audience, we did take care of many patients together that got their chemotherapy, got better, and are living normal lives.
Exactly.
Yeah. So
Yes.
it was very different, the experience that both of us had in taking care of patients, because typically, the notion is palliative care is to be involved when, all other treatment options have been exhausted. But here we were taking care of patients who were pursuing cure and very aggressive and intense medical interventions.
Yes. Um, for sure. I think a lot of people immediately assume cancer diagnosis, death, palliative care, dying. And that's definitely not the case. A lot of patients do need just that extra support that palliative care has to offer to get over that hump and then live that, normal life thereafter. It's truly, there's definitely misconceptions about what palliative care is. Palliative care, a lot of people just assume it's a different word for hospice, and that's not the case. Palliative care is 100% recommended in my book for anybody who's having any complicated symptoms with a lot of different things. It's not even just cancer patients, right? It could be heart failure patients and all kinds of different populations that truly benefit, different neurological diseases that would benefit from palliative care assistance or support. Um, I wish more providers would really learn about what palliative care can do for their patients, because in my mind, an oncologist, I'm just going to use an oncologist because that's my like go-to. Their specialty is writing for chemotherapy. Their specialty is to really tackle the cancer, and of course they're well versed in medications to help relieve the symptoms. Every body is going to respond differently to the chemotherapy, and some of the usual drugs that are used to help with those symptoms to be minimized, not everybody is going to respond to those drugs the same way. And palliative care has kind of their like extra little toolbox that they could bring to help that person get through their chemotherapy with less side effects, improved quality of life during that treatment time. And it's definitely not just an end of life conversation or goals of care. It's so much more.
Right? And we both got to experience that firsthand, taking care of patients together. Now, tell me, what do you like most about being a palliative care nurse practitioner?
I think really knowing that you're making a difference in somebody's life is just overall the overarching um, change maker in my life, right? Like it just, when you know that you're truly helping somebody and making a difference, that is what like fills my cup the fastest and the best. And I truly feel good about what I'm doing. Working in palliative care, I mean, you have somebody who, let's say they're on round 3 of their chemotherapy, and every round they've had these huge complications and they suffer so much. And then you step in as a palliative care provider and you're allotted, maybe more time to visit with them. You're really able to dissect what symptoms happen, when and how, and what you've tried. And you're able to bring that toolbox that I'm, going to keep referring to and try something and see if that helps. And lo and behold, here they are doing so much better than they were their prior treatment rounds. And you feel like you changed the whole world. And truly you have for that one person. And that just, I mean, there's nothing like it when you know that you're making a difference in somebody's life.
Absolutely. That's very well put. Now, you started off pursuing nursing, you became a nurse, you were a very successful nurse in oncology, then you pursued a nurse practitioner degree and you became a nurse practitioner in palliative care. And when you introduced yourself, you didn't mention any of that in terms of your current role, right? So what are you doing now? And because there seems to be a being a turning point in terms of your life.
Yeah.
Tell us a little bit about that.
So I never thought that I would be staying home and not working. I mean, I think you can tell, like, I truly love and enjoy taking care of patients. But being a mom is also very important to me. And I, of course, when I had my first child, I went back to work after 3 months of, maternity leave. And I went and I started working. And it hit me like, this isn't going to work for me, in the sense of what I've experienced as a nurse and has changed my life, in the sense of I've seen patients who are very, very ill, who, you have conversations with these patients over the years that maybe you don't realize they're going to affect you lifelong. But in the work that I've done, like I knew where my priorities were, and like, what is most important? Is it more important to create an income that you need to bring home to the family and provide, which is very important for survival and for providing a lifestyle for your family, etc. But I also knew, like, I didn't want to miss out on too much. And I was driving home late. I would get home, I would leave at like 7 o'clock in the morning. I would kiss my baby girl goodbye. I would go to work and I would, do my best there. I was distracted mentally. I wanted to be with my baby girl. I was really trying to be as much of a present provider as I could. But there was something pulling at my heartstrings, pulling at my thoughts. I would sometimes drive home and get home late in the evening, 6, 7 o'clock. And it was heartbreaking to know that I was going to have to get up and go do that again, Monday through Friday. Then I was basically left with being a full-time mom on the weekends and not really knowing how to do that. Saturdays were miserable for me. I would spend a lot of that time crying because my husband was gone. He would go and work on the properties that we own, and it was just me and this little girl who I'm her mother, but I don't know how to be her mother. So long story short, I, was pregnant with my second, and I thought, I'm not going to come back full time. I'm going to come back to work, but I'm not going to come back full time. I'm going to come back part time because I do love what I do, but I want to be home more with my babies. I'm not willing to like just throw all these years into work. I can work full time in the future if and when I need to. But I'm not going to throw myself into work. That is not going to be my priority. When I wanted to come back to work part-time, unfortunately, that wasn't an option in the position that I had. It was full-time or nothing. And so I had a conversation with my husband, and he said, nothing is an option for you if you truly want that. And so I didn't have to think too long about that. I jumped on that opportunity and decided to stay home. I knew that I wanted to not work full-time. And so here I am 5 years later, being a completely different mother than I ever thought I could be. I get to take them to school every single day. I get to pick them up. I get to make their meals. I get to do everything that I would love and want to do for them. I do miss taking care of patients, but I feel like that will come. Right now, I'm able to help patients or the community by helping people make decisions about their Medicare, and that sounds completely out of nowhere. But to me, after I drop the kids off and I do what I need to do for my home, I know that I have more to add to the world. And so I've found a way where I can help the population who is Medicare, which are typically the 65 and older. And I truly, I know that I bring a good heart to the table. I know that I'm intelligent and I can, really figure out all of the complicated situations for them. and I help them make really important decisions about which Medicare plan is best for them. And that feels good to me. It fills my cup just like nursing does, because I know that I'm truly helping people with a situation that um, some people may not be as honest or as focused on the patient's needs. So I feel like right now I'm kind of in a position where I have the best of everything. I would love to be a provider again, but being a parent is top priority for me. And I think that decision is not easy for most people. I think for even with deciding what you want to wear for the day, a lot of times you think about what are people going to think about what I'm going to wear, right? When you go and you get your master's degree and you've worked so many years in and you're good at what you do, you do think about what are my mentors going to think, what are my friends going to think, for me to make this decision to walk away from this career for a little while, to stay home with my kids. And that was a thought for a split second, and this was a decision that I needed to make for me. I do feel like there was a little bit of pressure on me to hurry up and go back to work. Again, from mentors and friends who were like, "What are you doing? Why aren't you working? You've had so many years of education. You're good at what you do. What are you doing?" But the truth is, my exposure in life situations with the patients that I've taken care of have really contributed to me making the decision to be at home with my kids right now, and be who they need me to be, while still filling my own cup in a way that truly makes sense for my family.
Awesome. So very courageous to have made that bold move. And just listening to you, there is a theme. There's a theme in your life story and the experience, and how you basically go out and try to find the right balance for yourself. You have a lot of passion. You want to help people. At the same time, you know what your priorities are, and what can wait and what cannot. Now, this has been fascinating to me. Uh, we will hear more about some of the things that you learn from your patients, that were the lessons you learned that were critical in you making life decisions. So I look forward to that.
Sounds good.
Thank you very much.
All right.
See you again.
Bye, Dr. B.